everyone, welcome back to my channel. My name is Nurse Kate and have your very cardiothoracic nurse. I'm happy to inform you that my book, Living with Hypertension Made Easy, will be releasing on the 4th of March 2023. So please watch out for my book. Please watch out, and I'm expecting you all to please support your girl on this mission. So today I will be speaking on cardiac arrest. As Nigerians, we know that our emergency response is still very, poor. We are still trying our best. However, a lot of things are happening around us, sort of cardiac arrest. From one place to another, people are collapsing, and people don't even know what to do. People will pour anointing oil on them. Some people will pour water. Some people will snap pictures, and we are not doing what we are supposed to do. So what do we do? How do we help victims of cardiac arrest here in Nigeria? As a nurse this afternoon, I will be speaking on cardiac arrest. So what is cardiac arrest? Cardiac arrest is a sudden cessation in the heartbeat. When the heart stops beating. When the heart stops beating, then the victim will suddenly collapse. And this has been happening around us. People collapsing in the kitchen, we have people collapsing in the church, collapsing at the roadside, at place of work like that. I'm sure you have heard of one. So that's how people have been collapsing. And when they collapse, what kind of help do they get from us? As we know, the greatest part that will suffer from this is the vital organs. And one of it is the brain. If the brain is not, did not get help within 4 minutes, the brain or cells can die. As well, if the other organs too did not get effective blood, then the other organs will start shutting down. So that is why we make use of our hand to save life. And that's why we are teaching everybody to please learn about what we call CPR, or cardiopulmonary resuscitation. So use your hand to save people around you. If someone suddenly collapses around you and you are not there, or maybe you've witnessed it, try and check around the person to know what are the dangers around this person. If the person is not having any issue, there is the environment, the person's environment is not having any other danger, then please move around the person and check the person is responsive to you. Then call the person. If you know the person by name, call the person, tap the person. If the person is not responsive, is unconscious, then try and check the person is breathing. Okay? If you see that the person is not breathing as well, please use your hand immediately to start what we call CPR. Start CPR. Start pressing the chest. Look at the center of the person's chest. Lock your hand very well and press it harder, faster and hard, fast and hard, so that the brain will get blood, the heart will get blood, the kidney will get blood. These organs will not die before you get to the hospital. So instead of pouring water on them, make use of the hand to keep pressing for circulation, so that there will be blood circulation all over the body. The body will still be getting oxygen while the person is still not still responsive to you. And keep doing this. Shout for help. If people around you are there, they can continue to do that CPR. Then please continue to do that CPR until you hand over the victim into the hand of health workers. Okay? When you hand over the victim, make sure you are doing. Make sure. I know it's not going to be easy. It's going to be tiring. Okay, but please keep doing this CPR. Do it as if you are saving your own husband. Do it as if you are saving your own son. Do it as if you are saving your own sister. Do it as if you are saving, your own very close family. So do it and give it all it takes till you hand over the person to the nearest hospital, workers. Just get the hospital around them, because we don't have what we call here like 911 or 122. We don't have such things like that. So keep doing that until you hand over the victim to the hand of health workers. So some people actually don't know what actually causes what we call cardiac arrest. Sometimes cardiac arrest can be sudden. Okay. Another thing that can cause cardiac arrest is heart issues. When someone have a serious high blood pressure, maybe you have cardiac arrhythmias, the heart has been beating so fast for some times, or the heart has been beating so low, the person can suddenly enter cardiac arrest. If you have diabetes, you might be a victim of cardiac arrest. If you have what we call coronary heart disease, you can later be a victim of cardiac arrest. If you are obese, okay, extremely fat, you are at the risk of cardiac arrest because of our sedentary lifestyle. Some of us can sit down in front of television from morning till night, checking our phone, not moving, not exercising our bodies. All this sedentary lifestyle can expose someone to cardiac arrest as well. If your sugar is extremely low, your person can be a victim of cardiac arrest. These are the things that can lead to cardiac arrest, and the person might actually start feeling unusual. We just tell you that these days I'm not really feeling myself, and I'm having serious chest pain these days. I'm noticing that I'm feeling dizzy. If I want to stand up, if I want to move forward, and this day I could not breathe quickly, I cannot breathe properly, and they will start giving you this kind of example that their heart is beating so fast, palpitation. And if you hear such complaint from your family member, from people around you, please encourage them to see doctor when they can still speak. Encourage them to tell their doctor when they can still communicate the symptoms to the doctor, and not when someone is helping them to explain, or we are explaining through investigations. So encourage them. If someone have these electrolyte imbalances, too much of potassium, or in the blood or something like that, or magnesium, all these things are things that we're supposed to check. If they're having issues in our blood, then the person can be a victim of cardiac arrest. So please learn CPR so that you save people around you. You save someone that need your help with your hand, so that we will stop pouring water, maybe cold or hot, I don't know, or forcing them to swallow anointing oil, or start praying on them when they have this attack. So please help this video will help us to learn one thing or the other about what we call sudden cardiac arrest, and help us to be an hero in saving life in the future. If you are new here, please, this is channel where we talk about nursing care, and heart health. And from all my subscribers, thank you so much for always checking on this video, liking, and reposting my video. Thank you so much for doing that. And don't forget, my book is coming soon on the 4th of March 2023. Thank you so much, and I will see you in the next video. Bye.